According to the Centers for Disease Control and Prevention, measles cases are on the rise nationwide. As of July 1st, there's been 1,267 confirmed cases across the country, including here in New York and New Jersey. That's just 7 cases shy of a record high since measles was declared eliminated back in 2000. Joining us now is Michael Angarone, infectious diseases specialist at Northwestern Medicine. Michael, good to have you with us. Thank you.
Thank you for having me.
So what's behind the recent spike in measles cases across the country? Like I said, back in 2000, this thing was eliminated, but we've heard so much about it here over the last year.
Yeah, so over the past 20 years, there have been a slow rise of cases throughout the world and the United States. And it's unclear why there's so many of the cases now. Part of that is the lack of people getting vaccinated, and we're kind of fallen below the threshold of around 95% of coverage of the measles vaccine. So now we have more people that are susceptible to the infection, and then they get the infection and it starts to spread much quicker than it would have when we had higher vaccine rates.
So let me ask you this. I know there's obviously, depending on the community, depending on what part of the country you live in, what state you live in, there is vaccine, reticence out there, or some hesitancy to be vaccinated, especially with something like this, where the vaccine is proven. As we've just mentioned, this was, basically eliminated in the year 2000. Why do we continue to see, though, in communities that are seeing the spread of this disease, such low vaccination numbers?
Yeah, it really started in the 1990s with some of the information coming out that the MMR vaccine, the measles, mumps, rubella vaccine, might have been associated with autism. That study was later retracted, and multiple studies have shown that that is not the case. The MMR is safe and not associated with autism. But those numbers started to fall. And then I think over the past 5 years, especially, we started to see declines with COVID. So kids weren't going to see the doctor and families weren't going to see the doctor. And we really haven't recovered from that. So there's been a lot of factors associated with that we're trying to work out.
And we live in a society now where a rumor or something like that gets out there, and depending on who's got the microphone, things like that get amplified, and then you wind up in situations like this where you've got the spread of measles. Many cases have been in young people, of course. You've got kids going to camps and after school or summer programs right now. Should parents feel safe sending their kids to places knowing that those vaccination mandates don't exist? I've heard countless stories of certain places that used to require some type of screening or form saying that you've been vaccinated are no longer required.
Yeah, I think it is something where parents are going to have to take it on a case-by-case basis what to do with their children. I think the best thing to do is make sure that your child and your family has had the 2 doses of the MMR vaccine. If they've had those 2 doses, they will be safe. As we've seen with the cases going on right now, over 90% have been in individuals that either unvaccinated or don't know their vaccine status. So very few have been in individuals that have received both doses of the vaccine.
We're showing symptoms on the screen right now. Before I do let you go, with the misinformation that does exist out there, how can professionals like yourself and doctors and whatnot convince the general population that getting these vaccines, they're safe, they're effective, and you really need it unless you want measles to be back again?
Yeah, so I think the most important thing is they are safe. These vaccines are safe. We've been using them for decades. They protect against infections that have a lot of morbidity, so consequence if you get infected, and they can lead to death of certain individuals. And we want to protect people as best we can. You don't want your child or your loved one to get sick with something that can be completely prevented with a safe vaccine.
Michael Angarone, thank you very much. We appreciate you taking the time. Infectious disease specialist at Northwestern Medicine. Michael, thank you for joining us.
Thank you for having me.
And for more information on